So imagine your body detects a microscopic structural flaw in your skin, just a tiny, almost imperceptible weakness.
Right, something that normally wouldn't even be an issue.
Exactly. In a normal scenario, your body would just quietly patch it up. You wouldn't even know it happened. But in this scenario, your immune system just goes into a state of absolute panic.
Yeah, it completely overreacts.
It works so frantically, sending in so much chaotic repair material that it ends up turning your own healthy, flexible tissue into, well, something resembling rigid, fragile glass.
It's really the ultimate biological paradox. I mean, the very mechanism designed to protect and repair the skin ends up systematically destroying its ability to function.
And that paradox right there is at the heart of today's deep dive. We are unpacking a really complex, chronic, and honestly incredibly misunderstood condition called lichen sclerosus, or
Yep.
LS. And, you know, while this can technically affect anyone, today we are zeroing in on how it impacts females. Specifically, we're focusing on a highly distressing physical consequence, which is the severe architectural changes and the profound life-altering loss of vaginal elasticity.
Right, and it's an aspect of the disease that rarely gets discussed openly. I mean, largely because of the stigma surrounding vulvovaginal health in general, yet the mechanical consequences for the patient are just enormous.
Absolutely. So whether you are, a healthcare professional looking to better support your patients, or someone personally navigating mysterious pain, or just a curious learner fascinated by how the human body operates, this deep dive is for you.
We really want to demystify this.
Right, because we're talking about a condition that affects up to 1.5% of women. That is a massive number of people dealing with an intensely painful reality, and they're often doing it entirely in silence.
Yeah, and addressing that silence really starts with correcting a very common misconception about who actually gets lichen sclerosus.
Right, because if you hear about it at all, it's usually framed as something that happens either to young girls before puberty or to women after menopause.
Exactly. And that bimodal peak, those two distinct age groups, that is a real statistical trend. But it completely leaves out a massive demographic.
Because it's not just a pediatric or geriatric issue.
Not at all. A huge portion of women with LS, sometimes up to 40%, are experiencing profound symptoms during their reproductive years.
Wow.
Treating this as just an age-specific issue leaves millions of women in the dark, often suffering for years, before a clinician actually correctly identifies what's happening.
And misdiagnosis is so common, right? Because on the surface, it might just look like a stubborn yeast infection or maybe severe eczema.
Yeah, the visual cues can be very misleading early on.
But when we pull back the curtain and look at what is happening on a cellular level in these clinical studies, this isn't just a simple rash. It is a full-blown autoimmune war zone.
That's a highly accurate way to frame it, honestly. The immune system gets deeply confused. Specialized immune cells, specifically T cells, infiltrate the area and start broadcasting out intense chemical alarm signals. The cytokines, right, like IL-4 and TGF-beta? Exactly. Those specific cytokines act as the alarms, and they activate the body's rebuilding factories, the fibroblasts. But because these factories are operating in a chaotic, highly inflamed environment, the collagen they pump out is completely abnormal.
Like specifically type V collagen, right?
Yes, exactly. It's like trying to build a delicate structure while the fire alarm is blaring, the sprinklers are going off, and the workers are just blindly throwing concrete everywhere.
That is a great analogy.
And the specific target of this autoimmune attack is fascinating to me. The immune system is zeroing in on a glycoprotein called ECM1,
Right, ECM1.
which is absolutely critical for structural integrity. It sits right at the junction between the deep layer of the skin, the dermis, and the outer layer, the epidermis.
So it essentially functions as like the body's biological glue.
Yeah, pretty much.
It holds those two distinct layers together so that when you move, the skin stretches and moves as a single cohesive unit. But if the body is producing autoantibodies that specifically attack and dissolve that ECM1 glue, that entire scaffolding falls apart.
The layers lose their connection. And when that underlying basement membrane degrades, the body realizes its structural integrity is failing. That is what triggers the massive panic we talked about.
And that's when it dumps all that stiff collagen.
Right. To patch the failing glue, the body overproduces this incredibly stiff material, depositing a glassy, hyalinized layer throughout the upper part of the skin.
Which leads to a cellular finding in the Journal of Cutaneous Pathology that completely tripped me up at first.
The elasticity paradox.
Yes, because researchers taking biopsies of this tissue, looking specifically at the elastic fibers, found something deeply counterintuitive. In that upper layer, just under the surface, the elastic fibers are completely obliterated. It's just a glassy wasteland.
Right.
But when they look deeper into the tissue, in the mid to lower dermis,
They found a significant increase in elastic fibers compared to normal, healthy skin.
hold on. This is where the logic seems to completely break down for me. If the defining characteristic of this condition is a total loss of elasticity, where the skin becomes incredibly tight, rigid, and fragile, how does having more elastic fibers deeper in the tissue make any sense?
It seems like a total contradiction.
Right. Shouldn't a massive influx of elastic fibers make the area stretchier?
You would certainly assume so.
Ah,
But you have to remember, an elastic fiber can only stretch if the surrounding environment actually allows it to move.
okay.
Because that upper layer of skin is now packed with that stiff abnormal collagen. And the biological glue connecting everything is destroyed, the overall mechanics are ruined, the new fibers are just a frantic repair process.
So it's like running a bungee cord through a concrete pipe.
That is the perfect way to visualize it.
The bungee cord is technically in there, like it has the mechanical capacity to stretch, but the concrete casing around it makes stretching completely impossible.
Exactly. The tissue entirely loses its functional stretch, no matter how many elastic fibers are frantically being built down below.
Wow. So if we take that concrete pipe analogy and look at how it manifests on the macro level, on the outside of the body, the reality for the person experiencing it is pretty devastating.
It truly is.
Because the skin loses all its functional stretch, it takes on this pale, almost ghost white appearance. The sources describe it getting incredibly thin and wrinkled, often noted clinically as looking like wax paper or cigarette paper.
Right. It looks paper thin, but mechanically it behaves with absolute rigidity.
And it bruises easily, right? Like the purpura mentioned in the texts.
Yes. Because the tissue is so fragile and the tiny blood vessels underneath are damaged by the constant inflammation, you'll frequently see severe bruising just from normal daily movement.
Which brings us to the mechanical nightmare of vaginal elasticity loss. Because if you have skin in a highly mobile, high-friction area of the body that's functioning like rigid wax paper, any pressure causes problems.
Any pressure at all.
Whether that's physical intimacy, riding a bike, or even just sitting down in tight clothing, it causes that fragile skin to literally physically split open.
It tears. And those micro tears, or even larger fissures, introduce a whole new level of complication. Because when the human body heals a tear, it doesn't just magically lay down nice, new, flexible skin.
Right. It patches the hole with scar tissue.
Exactly. And scar tissue is inherently inflexible.
Yeah.
So you are trapped in a compounding loop.
A vicious cycle. The rigid skin tears. The body heals it by laying down a rigid scar, and then that scar creates an even tighter, less forgiving boundary.
Which practically guarantees even more severe tearing the next time the area is stretched.
And over time, as that cycle of tearing and dense scarring repeats over and over, it leads to severe architectural distortion, like the actual anatomy of the vulva begins to fundamentally change.
The descriptions in the clinical texts of this physical transformation are harrowing.
Yeah, I mean, the labia minora, the inner lips, they can literally resorb. They shrink away and slowly fuse into the surrounding tissue until they essentially disappear.
And it affects the clitoris, too. It can become completely buried under a thick, fused hood of scar tissue.
Right, what they call clitoral phimosis. It physically traps it.
Yes. And the entrance to the vagina itself narrows severely. A thick band of scar tissue builds up at the opening, creating a condition known as introital stenosis.
It acts like a rigid ring just closing off the entrance. And these aren't just superficial cosmetic changes.
No, not at all. This architectural fusion and extreme loss of elasticity leads to severe dyspareunia, which is intensely painful sexual intercourse.
And it causes those chronic fissures too, right? Vulvar granuloma fissuratum.
Exactly. Chronic, deep splits in the tissue that just refuse to heal. It can even cause urinary issues if the scarring forms adhesions over the urethra, literally physically blocking the stream.
When you lay out those physical realities, the human cost becomes overwhelmingly clear. Because beyond the mechanical pain, individuals with LS often experience a maddening chronic itch. Pruritus.
Yes, an itch that can disrupt sleep for years.
The psychological toll is immense. The sources show high rates of altered genital self-image, anxiety, and depression.
The isolation cannot be overstated here. When the very structure of your body is aggressively changing against your will, and a fundamental avenue for intimacy becomes a source of agonizing pain, it's devastating. Nearly a quarter report that sex is rarely or never satisfactory.
And on top of that physical and emotional burden, There is a statistic that hangs heavily over a diagnosis like this. Women with this condition face a roughly 4 to 6% risk of developing vulvar squamous cell carcinoma.
Right. Skin cancer on the vulva.
Hearing that you have a 4 in 100 chance of developing cancer is terrifying.
It is deeply frightening. But this is where understanding the underlying mechanism changes everything. That cancer risk isn't just a random roll of the dice, It is directly tied to the unchecked inflammation.
Because the immune system is constantly damaging the tissue and forcing it to rapidly rebuild.
Precisely. The chronic, unrelenting cellular chaos and the rapid turnover of tissue, that creates a highly unstable environment where cellular mutations are just far more likely to occur.
So it's the environment that's dangerous.
Yes. But if you stop the inflammation, you halt that chaotic environment. The literature is very clear on this. Proper, consistent clinical treatment dramatically lowers the cancer risk.
It transforms a terrifying statistic into a very clear, actionable reason to get proactive about long-term management.
Exactly. Early diagnosis and consistent management are absolutely vital.
So how do we flip that switch? If unchecked inflammation is the driver behind the tearing, the rigid scarring, and the cancer risk, how do you turn off an immune system that is actively attacking its own biological glue?
Well, the gold standard for halting the autoimmune attack is the use of super potent topical corticosteroids, like clobetasol propionate of 0.05%.
But this goes way beyond just like applying a little anti-itch cream when a flare-up happens, right? The UK guidelines lay out a very specific induction regimen.
Yes, it requires a massive initial strike. You have to hit the inflammation incredibly hard at first to put the fire out.
Right.
Patients typically apply a specific amount, usually 1 fingertip unit, every single night for 4 weeks.
And then they taper it down, right?
Yes. Once the immune system's panic response is suppressed, you move to alternate nights for 4 weeks, then twice a week for 4 weeks.
Until you reach a long-term maintenance dose.
Exactly. The goal shifts from extinguishing a blazing fire to simply keeping the embers cool so they don't reignite.
And alongside the steroids, there is a heavy emphasis on using thick emollients, like intense moisturizers.
Yes, heavy emollients are crucial to protect the skin barrier.
Because if the steroid suppresses the dysfunction from the inside, the emollient acts as a protective shield on the outside. It keeps whatever structural integrity is left hydrated and defends the fragile skin against irritants like urine.
It really requires that strict dual approach to stabilize the tissue.
But that brings up a massive complication for me. A steroid can stop the inflammation, sure. It can prevent new scar tissue from forming. But what if a patient has been suffering undiagnosed for years?
Right, when the structural damage is already done.
Yeah. If the labia have already fused, or that rigid ring of scar tissue has severely narrowed the vaginal opening, a steroid cream can't magically dissolve established hardened scar tissue, can it?
No, it cannot. Once those severe architectural changes have set in, reversing the elasticity loss requires physical and sometimes surgical intervention.
Okay, so what's the first step there?
If we're looking at a narrowed vaginal entrance, the first step is usually aggressive conservative management, basically manual dilation.
Essentially physical therapy for the vaginal opening.
Yes, using graduated vaginal dilators to slowly, mechanically stretch the tissue over time.
And they often pair that with pelvic floor physical therapy, right?
They do, because the surrounding muscles usually tense up and spasm in response to years of chronic pain, which just makes the narrowing feel even tighter.
But what happens when the scar tissue is simply too thick and too rigid? When the concrete pipe will not stretch no matter how much physical therapy you do?
That's when surgery becomes the next step.
The NHS texts mention one procedure called a median perineotomy, or a Fenton's procedure, which involves cutting away the restrictive band of scar tissue at the vaginal opening to widen it.
Right. But surgeons have to approach this with extreme caution. There is a massive caveat in the vulvovaginal disorders text regarding operating on someone with lichen sclerosus.
Wait, yeah, because if the condition is literally triggered by the body overreacting to tissue damage by laying down rigid scar tissue, wouldn't taking a scalpel to it just set off a massive alarm bell?
That is the exact problem.
Wouldn't the body just aggressively scar right back over the surgical cut?
Yes, it would. If a surgeon performs a simple excision called lysis, where they just cut out the scar and stitch the edges together, the body will almost always heal by forming a new, often tighter adhesion. The restrictive ring just comes right back.
So how do you actually widen the entrance without triggering the body's natural impulse to just ruin it again?
To truly fix severe introital narrowing, surgeons perform a much more complex procedure. It's called a vaginal mucosal advancement, or a vulvoperineoplasty.
Okay. How does that work?
Well, they don't just cut the scar, they remove the rigid area entirely. Then they do a wide dissection to mobilize healthy, unscarred, highly elastic tissue from the deeper vaginal wall.
Oh, so they pull the healthy tissue down from inside.
Exactly. They advance that healthy, non-scarred vaginal mucosal tissue down and over the excised area, creating a completely new boundary.
It's like taking a rigid shrunk collar off a shirt. And instead of trying to stretch the ruined collar, you pull up stretchy, untouched fabric from the back of a shirt to tailor a brand new neckline.
That is exactly how it works. You are importing healthy, flexible mucosa that hasn't been targeted by the autoimmune attack to replace the rigid, ruined skin.
Wow.
And of course, post-surgery, the patient still maintains the topical steroid treatments to ensure the immune system doesn't turn its attention to the newly tailored tissue.
Naturally. Well, we have covered an immense amount of ground today. We've seen how a microscopic autoimmune attack on the body's biological glue creates a catastrophic mechanical failure.
It's a heavy topic.
It is. The body panics, pumps out abnormal collagen, and turns flexible skin into a fragile, rigid shell.
Which sets off that devastating cycle of tearing and dense scarring, fundamentally altering female anatomy and causing profound pain. But, and this is the critical takeaway, this cycle can be broken.
Right? Targeted, super potent steroids can shut off the immune alarm. Physical dilation and highly precise surgical interventions, like pulling down that healthy internal tissue, can bypass the scarring and restore function.
Recognizing the symptoms early is paramount. If you or someone you know is dealing with unexplainable chronic itch, pale patches of skin, or tiny recurring tears, seeking specialized care can halt the inflammation before those irreversible structural changes ever happen.
You do not have to just live with the pain.
Absolutely not. Knowledge really is power here.
It is. It changes the entire trajectory of this condition. But before we wrap up, I want to leave you with one final thread to pull on.
Oh, I like where this is going.
Because we talked heavily about the immune system and the skin's architecture today, right? But the sources briefly mention an emerging frontier of research that hints at a totally different trigger.
The microbiota.
Yes. There is growing evidence that the microbiota, the precise balance of bacteria living in your gut and on your skin, might actually play a crucial role in kicking off this autoimmune confusion in the first place alongside genetics.
It is a completely new frontier of understanding.
It really is.
Yeah.
It makes you wonder, could the future of treating this localized mechanical loss of vaginal elasticity, this rigid scarring on the outside of the body, actually lie in manipulating the microscopic bacteria deep inside our gut?
It's a fascinating question.
Could balancing your microbiome one day prevent the body's biological glue from ever coming under attack? It completely shifts how we view the interconnectedness of our own biology. Something to ponder until next time.